Cool. So it's 8 o'clock now. I'll get going. Again, feel free, please, to comment and ask questions as you have them. I'm happy to answer. So like I was saying, I'm just about to finish residency. I am a resident at the West Haven VA. So the specialties there are ocular disease and low vision acquired brain injury rehabilitation. It's a pretty unique program that I'll talk about a little bit later on, but I want to kind of talk about why I chose to do a residency and what kind of led me to where I'm at with that today. So going through optometry school, I went to NECO, and I wasn't quite sure if I wanted to do a residency right away. It was just always something that was in the back of my mind, but I was never sure if I really wanted to do it. And then during my 4th year, I had a rotation at the Long Beach VA in California. I had a chance to do some low vision work over there, and I really, really enjoyed that. And that kind of pushed me to deciding to pursue a residency. So I kind of looked at the pros and cons of doing it and the reasons to do it. First and foremost, I never heard someone who said, I'm unhappy that I did a residency. And I think that really speaks volumes to the benefit of it for ODs. You'd think that having run into a lot of people through school and on different clinical rotations, someone would have been upset with that decision, but it didn't seem like anyone was. So that was a big benefit for me there. Also looking at that, it seems like you could get so much out of only 1 year of not even sacrifice, but out of doing a program. You really, really benefit. You're intense with seeing patients and didactic material and education and precepting students and doing all these different things that you wouldn't really get to do altogether if you didn't have a residency there. Looking forward past residency, I wasn't quite sure what I wanted to do and where I wanted to practice and in what sort of modality. So I didn't want to close off any kind of doors by not doing a residency. So I decided it was probably best to do one just in case down the road I decided to do something where I needed that residency background. And then even through school and all rotations and everything, the vast majority of my preceptors and lecturers and attendings had done residencies. And these were all really talented doctors who provide excellent patient care, and that you want as a student to emulate and practice like them. And they had all really benefited from their residencies. So it seemed like a really good option. Looking just broadly at residencies, obviously you can learn more about a specific area that you want to train in. For me, that was ocular disease and low vision, like I said. You get to train under some really, really great docs, depending on where you are. I mean, every residency has great docs. You have a great deal of independence after the first kind of breaking in period of your residency, but it's not so much where you're on your own. You're not out on an island ever. You always have your attendings around that you can run things past, talk through tough cases with, and that sort of thing. But your run-of-the-mill mild NPDR patient, you don't really need some help with. You're good to go on your own with that, and that's super nice. You can increase your professional opportunities through residency. You're meeting a lot of different people. You're going to different conferences. You're networking. Depending on what area you're in, if you want to stay there, you can network within that area and find out which practices are hiring, where other good opportunities might be. One thing that's kind of unique about the West Haven residency is we work really, really closely with the ophthalmology department. Yale Ophthalmology is through the West Haven VA as well. And the optometry residents actually present to the Yale specialists. And we do that a couple times a week, every week, for retina, glaucoma, uveitis, cornea, neuro. And we get to work directly with them, present our own patients to them. And that's really helpful for a variety of reasons. One, you're getting experience with different specialists in general. So it's nice to know what those specialists are looking for. It's really helped in understanding what patients need to be referred to specialists versus what I would want to hold on to for a little bit longer and could hold on to for longer. And then it's also really helpful too, because we're able to learn what ophthalmologists do really well, and they're able to see what we do really well and how that can become a cohesive working relationship. And that's really nice. It kind of gets past a little bit of that friction that's inherent between our two professions. So that's nice to have there. And it's a really, really big benefit there. And then another thing with residencies is you're working with fairly complex patients for the most part. I know at the West Haven VA, our typical patient has several comorbidities. They're coming in, no one's coming in as a 28-year-old healthy myope. You might get one of those a month. Everyone else has some sort of pathology, something that you can learn from no matter what. Not to say you can't learn something from those 28-year-old myopes, but it's different. You're being challenged on a different level pretty much with every patient you see in one way or another. And that's great. And that's something that I was really looking for. I wanted to use my residency year to become the best doc that I could possibly be, get the most out of this year that I could. And I would suggest anyone who's looking at residency or about to start residency next week, start residency next week, to really take advantage of the year that you have. It goes by a lot quicker than you think it will. And you don't want to get to the end and say, oh, I wish I had asked more questions. It's a really, really good time to learn. And it's a really good time to push your boundaries as a clinician. And it's really great. Obviously, there's some downsides for residency. I mean, not everyone does one. There's got to be some reasons why. As residents, we don't make very much money. So you have that to kind of contend with for a year. And then, I mean, people have a host of personal reasons why they don't want to do a residency or can't do a residency. A lot of people have something set up for after optometry school where they can go right into practice and have a great situation. And that's awesome. And for a variety of other reasons, people aren't interested in the residency, and that's cool too. I think it's a really important thing for our profession to have. I think it's something that, or at least it's something that I hope more people take advantage of. And it can really push us forward as clinicians and as docs. So just talking a little bit about my past, I guess, year and a half since I started applying to residency. Like I said, I was at Long Beach VA. I got to do some low vision there. They have a blind rehab center, which is an inpatient blind rehabilitation program. So you'll have inpatient veterans who stay anywhere from a few weeks to up to 10 or 12 weeks with a full-scale rehab team. So low vision is one part of that, as well as O&M, living skills, technology, a whole host of other specialists that work with these vets and really teach them quite a bit over that period of time. So there's, I believe, 10 of those in the country through different VAs. So Long Beach has one. So I wanted to do my residency in a similar type of environment. So I looked specifically for programs that I could do that in. And then on the flip side, I was really interested in ocular disease, and I really wanted to push myself in that regard as well. So I wanted to find a program that had a strong ocular disease presence as well as a strong low vision rehab presence. So I went on ASCO. I was able to filter through by different specialties and things of that sort, and came up with 4 or 5 programs that I was going to apply to with varying levels of low vision and varying levels of ocular disease. Got my reference letters, sent in my applications, set up interviews. I think all of my interviews I did over the course of maybe 3 or 4 weeks in January last year. Luckily for me, I happened to be on the East Coast. Most of the programs I applied to were on the East Coast within driving distance, so I was able to get to those relatively easy. Ones that were further away, I was able to do a phone interview with, which was great. No issues there. I know that some people are able to fly out for those interviews that are a little bit farther away. I would say that it's probably best to do it in person if you're able to, but of course there's no bias from the programs if you don't go out in person. That's all right too. So went through all of that and then found out that I had matched at West Haven, was very excited, finished up with school, graduated, had a little bit of time off, and then we started July 1st. And starting residency is something that's, it can be a bit daunting, I think. There's a lot going on all at once. You are learning you're learning new procedures from your facility. You're learning how to deal with a bunch of different attendings and preceptors and what they like and don't like. For us, we were learning a low vision exam, an ABI exam, and all of our subspecialty clinic exams. So we had a lot kind of on our plate right from the get-go. And for the first, I don't know, month to 2 months, it's a little bit overwhelming, and you gotta push through it, and you work hard and you really get on top of it. But it's good because it makes you really pay attention to what you're doing. It makes you, or it drove me to be really invested into what I was doing, which was nice because I didn't want to work hard for something that I didn't enjoy. And then kind of from there, once you get out of summer and into the fall, things seem to smooth out a little bit. Everyone, I have 3 other co-residents who are with me. We all kind of fell into a nice little rhythm. Everything started to feel good. We were coming in every day. Things were going routine. We had our academic stuff on the side as well, doing academy posters, as well as interdepartment meetings and grand rounds and all of these other educational activities. And it really starts to fall into place at that point. You're still obviously learning a lot, but you're gaining a lot more independence as you're doing it and pushing yourself further. You're beginning to precept at this point in time with some of the students, which is really nice, something that I really, really enjoy. And then that kind of rolls you into the winter, and you're continuing to build up and take more independence and see more patients. And then, as everyone knows, for us, our residency year got, I wouldn't say derailed a little bit, but changed from the ordinary for a bit because of COVID. The VA for us pretty much shut down outside of emergency appointments. So for, I don't know, 2 months maybe, we were doing a lot more educational activities. We were watching a lot of lectures. We were working on our end of year papers and end of year presentations, really trying to soak up as much knowledge as we could in that time while we had some free time outside of normal patient care. Within that, we were still seeing those emergency patients. So we saw a lot of foreign bodies, uveitis, PVDs, just a lot of things that were coming in that needed to be taken care of right away, which was nice because in a normal clinic flow, you might not see a whole bunch of those back to back to back, but we got several of them right in a row. So you really nailed down those kind of those urgent situations that you're looking for. Let's see. Susan asked me, how competitive is the application process? I don't know, to be perfectly honest with you. I haven't really talked numbers at all with my residency director or anything like that. Just judging from the amount of applicants who came into West Haven this winter, I think we had probably 10 to 12, I would say. And from what it sounded like, it was a little bit lower of a year. But there's 4 slots, like I said, at West Haven. So I guess it's fairly competitive. It's a pretty specialized program. You really have to want that specific type of program. So yeah, I think it's, depending on the site, it can be very competitive. Like I know a Bascom Palmer or a Mass Ioneer where they only have 1 spot, maybe 2 spots that a lot of people are going to be applying to. Those are obviously a lot more competitive than ones with a few more slots open. But I wouldn't say that there's any downside to applying to those competitive spots. And even if you don't match at your dream program, and you either matched your second or your third choice, or you post-match later, you're still ending up with a great residency, a great program, a great place to learn. So as far as competitive goes, I think it depends on the program, but I don't think you're going to be in a bad spot applying to any program that you could actually. So yeah, I guess that's what I had from my experience so far. I'm happy to answer questions for people who are interested in residency, looking towards it or getting ready to start it next week. Yeah, really open for whatever. Also, thanks, Dimitri. Cool. So if no one has any other questions, I guess that's it for me today. Let's see. Do you have one case that stands out? I've had a lot of interesting, challenging cases this year. Actually, I ended up writing my end of year paper on a patient who came into the acquired brain injury clinic with distance horizontal diplopia for about the past 10 years. He hadn't been able to get this solved. He'd had prism correction in the past, and nothing really had solved it. It seemed to be that his diplopia was coming in closer each year. He originally noticed it